In today's video, we'll explore two important newborn cases that highlight different clinical challenges. The first focuses on selecting the appropriate treatment for perinatal infection, and the second one involves recognizing an abnormal neonatal condition based on early neurologic and systemic signs. A 12-day-old infant is brought to the clinic by her mother due to redness and discharge from the left eye that started earlier that day. The infant was born at term via spontaneous vaginal delivery and has been otherwise healthy. The mother received limited prenatal care and reports she had some vaginal irritation during pregnancy but did not seek medical attention. On physical exam, the infant appears well afebrile with mild eyelid swelling, conjunctival injection, and a thin mucopurulent discharge. A rapid diagnostic test is positive for chlamydia trachomatis. Which of the following is the most appropriate treatment? A. Intravenous penicillin G. B. Oral erythromycin. C. Oral sulfacetamide. D. Oral tetracycline. E. Topical erythromycin. The correct option here would be B, oral erythromycin, and that is because systemic erythromycin therapy is recommended for infants diagnosed with chlamydia conjunctivitis to prevent complications, particularly the development of pneumonia. This approach is essential because chlamydia trachomatis can also colonize the nasopharynx and progress to lower respiratory tract infection. Let's have a look at why the other options are incorrect. Option A is incorrect because intravenous penicillin G is the treatment of choice in infants with suspected congenital syphilis. Option C is incorrect because systemic administration of a sulfonamide is avoided in newborns because of the potential to displace bilirubin from albumin, resulting in hyperbilirubinemia and an increased risk of kernicterus. However, sulfonamides may be prescribed after the immediate neonatal period for infants being treated for a chlamydial infection who do not tolerate erythromycin. And option D is incorrect because both short-term and long-term administration of oral tetracycline to children younger than 9 years of age has been associated with permanent tooth discoloration and is generally not recommended unless no adequate alternative exists. And option E is incorrect because topical erythromycin is commonly used in newborns to prevent and treat gonococcal conjunctivitis. However, it is ineffective against chlamydial conjunctivitis and does not clear the respiratory tract infection. A 7-day-old newborn is brought to the clinic by his father due to persistent irritability and difficulty feeding. The father reports that the baby has been crying constantly with a high-pitched sound and appears unusually stiff. He also mentions that the child's mother used heroin during pregnancy and is currently undergoing rehabilitation. On examination, the infant exhibits increased muscle tone, frequent yawning, and tremors. Which of the following is the most likely diagnosis? A. Cerebral palsy. B. Hyperthyroidism. C. Hypothyroidism. D. Neonatal abstinence syndrome. E. Pyloric stenosis. The correct option here would be D, neonatal abstinence syndrome. Neonatal abstinence syndrome occurs due to prolonged exposure to opioids during pregnancy. Affected newborns may show symptoms of excessive sucking, high-pitched crying, increased muscle tone, irritability, seizures, frequent yawning, sneezing, vomiting, and poor feeding. Let's have a look at why the other options are incorrect. Option A is incorrect because cerebral palsy is a group of conditions that involve permanent motor dysfunction with dysfunctional tone, posture, and movement. Option B is incorrect because infants with hyperthyroidism can present with low birth weight, warm skin, tachycardia, irritability, hyperactivity, and goiter. Option C is incorrect because congenital hypothyroidism is the result of thyroid hormone deficiency, and they can present with poor feeding, low muscle tone, prolonged jaundice, and a hoarse cry. And option E is incorrect because pyloric stenosis presents with projectile vomiting several weeks after birth and sometimes an olive-shaped mass in the abdomen on examination.